Hi, I'm Heather Banks, and I'm a family nurse practitioner here at the TMJ and Sleep Therapy Center in Granger, Indiana. I treat patients alongside Dr. Daniel Clower for TMJ and sleep therapy issues. What I'd like to talk about today, however, is diet. I know that the word alone can strike fear into the hearts of many, so we want to make this an easy topic to discuss and an easy way to implement dietary changes into your life. I'd like to talk about an anti-inflammatory diet because we know that an anti-inflammatory diet can reduce many chronic medical conditions that people are suffering with every day. What do we think of when we think of inflammation? Well, inflammation, most of us think of as a localized issue to an area that is in response to an injury. So we think of redness, heat, and swelling. But chronic, low-grade systemic inflammation can affect us from head to toe. And diet can play a big role in reducing that inflammation and improving chronic medical conditions. There are several chronic medical conditions that are affected by diet. Cardiovascular disease, mood disorders such as depression, and certainly chronic pain, which a lot of TMJ patients are suffering with. Many diets already incorporate anti-inflammatory foods as the cornerstone to their dietary plan. Some of these diets are the Mediterranean diet, the Zone diet, and the Paleo diet. They are all directing dieters towards these anti-inflammatory foods. So let's talk about what these foods are. Well, we know that refined sugars really affect inflammation in the body. So what's a refined sugar? Well, that's table sugar, syrup, and honey. Those are a couple examples. Also refined grains and the products that are made from refined grains, such as white bread, wheat bread, pasta, cakes, cookies, all the things that we love in an American diet. Trans fats also affect inflammation in the body, and these are the fats that elevate that bad cholesterol, also known as LDL, and lower our good cholesterol, known as HDL. Omega-6 seed oils can really cause a lot of inflammation as well and can affect our cardiovascular health. And these are sunflower, safflower, corn oils, cottonseed, and also soybean oils. But the good news is that even with that list of things we can't have, there are many more anti-inflammatory foods that we can welcome into our diets. So these consist of grass-fed and finished meats, wild-caught fishes such as salmon and tuna, which most of us love, omega-3 eggs, vegetables, dark leafy greens, and there's an abundance of those. Certainly fruits, nuts, omega-3 seeds such as flax, chia, and hemp. Nice addition to those leafy greens. We can have tubers such as yams and sweet potatoes. We can also have fruits and nuts. Dark chocolate, which I'm a fan favorite of. It can be added to cherries to be an anti-inflammatory sweet treat. And then we also can cook with olive and coconut oil. So we have a lot of great options to make anti-inflammatory foods a part of our daily diet. Removing these pro-inflammatory foods from our diet for just 4 to 6 weeks can often yield pretty significant health improvements in patients. We can see cardiovascular things start to settle down, blood pressure lower, chronic pain and inflammation start to subside. So patients might notice their joints are feeling better, jaw joints are certainly feeling better, GI issues start to settle down. The goal is to look at the long-term health benefits of an anti-inflammatory diet rather than just weight loss. That makes it a lot more sustainable to maintain these changes, because if weight loss is the only focus and we don't see that scale move in the direction that we want, you can become frustrated. Weight loss is, however, often a side effect of an anti-inflammatory diet. Some other things that we might want to incorporate into our lifestyle that help with this inflammation, along with these dietary changes, are adequate sleep, adequate hydration, control of mental stress, and increasing physical activity. So those things in combination can really make a big improvement in our overall health. Dr. David Seaman wrote an amazing book called The Deflating Diet. It's got tons of tips and tricks on how to make this diet a part of your daily lifestyle rather than just a diet. I would encourage you to get the book and read through it if you're interested in learning more.